I'm Elizabeth Ratchford. I'm the director of the John Hopkins Center for Vascular Medicine in Baltimore, Maryland. I'm a non-invasive vascular specialist. I work in cardiology at Hopkins, but I'm not a cardiologist and I'm not a vascular surgeon. But I specialize in vascular medicine, which is the non-invasive diagnosis and treatment of blood vessel problems. I see patients with all kinds of vascular disorders, but especially fibromuscular dysplasia, and I run the FMD clinic at Hopkins. And in my spare time, I also serve on the executive board of the Society for Vascular Medicine. I've been the secretary for 2 terms now, and in September I'll be taking over as program chair and president-elect. And then I also am the editor of the patient page section of the journal Vascular Medicine. So that keeps me pretty busy, but in my spare time I also like to travel and to read. I run my neighborhood book club, and I also enjoy all the time that I get to spend with my 2 teenage sons and watching them on the soccer field and on the basketball court and on the track. So our FMD clinic at Hopkins usually starts with some kind of referral. Sometimes I get emails from patients from across the country and they want to come in for a visit. So then my assistant Rose helps with the coordination of obtaining all of the outside records and the outside imaging. And we have Johns Hopkins Image Share is a portal that they can push the images to for us to review during the clinic visit, or sometimes we mail CDs and we upload those, but there's always obtaining a lot of information in advance so that we have everything that we need for the consultation. I usually see the FMD patients on Wednesdays and Thursdays, and we have special slots reserved for them because they're often quite anxious at the time of diagnosis and really don't want to wait 6 months for an appointment. So we have special slots reserved so that they can get in sooner rather than later. I also have medical licenses in Maryland, Virginia, as well as Florida, so that we can do telemedicine visits if needed. Sometimes people prefer to come in person for the first visit just so we can get to know each other and go over all the imaging in person, but then for follow-up visits, telemedicine is often adequate so that we can share the screen and review the images together and catch up on things without having too long of a drive. But then there's usually annual surveillance visits, and then I also coordinate with all of my colleagues in different fields like interventional neuroradiology and neurosurgery and vascular surgery, neurology. We have a headache clinic, and there's a lot of specialists as well as the cardiologists that deal with spontaneous coronary artery dissection with me. So it's really a multidisciplinary approach, but I'm kind of at the center of that to coordinate all the care with the other specialists. So I think it was around 20 years ago that I first learned about fibromuscular dysplasia, aside from the short sentence in the med school textbooks that we learned, that I learned many years ago. But in meeting Jeff Olin and working with Jeff Olin and training with him around 2003, and then meeting Heather Gornick shortly after that, and Esther Kim, and all my colleagues who share this same passion and excitement for the new discoveries of something that hasn't been well described, and how there's new stuff coming out all the time, and it really has been an exciting field that I've watched develop over the past couple of decades. I really enjoy the process of helping people go through this difficult time when they were totally healthy, and then all of a sudden there's this kind of earth-shattering news that they get. And with that comes a lot of anxiety, and working through that with them is very rewarding, because in the beginning it's scary, but then once you are armed with a lot of knowledge, and it really makes it easier. And we have My Chart, which is a great way to communicate with the patient portals, because a lot of questions come up, and can I do this, and can I do that, and what do you think of this, and is this medication okay? So being able to just answer quick questions and being available has been really rewarding, and shepherding people through this process as their levels of anxiety go down over the course of their time. And then also helping them to get into exercise again, and then connecting them with resources such as the FMDSA, which is has such a huge benefit for the patients. And I think the FMDSA really is the future of FMD as well, because there's still so much that we don't know, and all of that is going to come from the registry and all of the work. There's really been an explosion in the research over the past few years, and I expect that to continue. I'm particularly interested in seeing how that plays out with regard to the mesenteric arteries. We're doing some work on that at Hopkins about really looking with the imaging. Our imaging quality has improved so much over the past few years, so I think we're going to be detecting more things that we haven't previously appreciated. And also the diversity of the populations affected by FMD, I think, will be really critical in the future. And then I think the genetics is another really interesting area of research, and I expect that the FMDSA will lead the way in that, and I hope to remain involved.